Cocaine. So, intoxication with cocaine, you absolutely have to know. Pupillary dilation. You have tactile hallucinations, kind of like sometimes you think, bugs are just on you and eating your skin. Sudden cardiac death. Super huge. Perforated nasal septum, always have to be on the lookout for that. You can look at it and see that there's a problem there. They'll always ask questions regarding the perforated nasal septum. You'll have the patient constantly touching their nose. A lot of things can give you a kind of a heads up. Beta blocker therapy, very controversial as first-line therapy. Why? Because then you have, an unregulated, alpha effect. Constriction. Definitely not good. Can cause problems. I saw someone when I was doing one of my rotations took cocaine for the first time. All of a sudden they had a constriction of their vessels, had a stroke, the entire left side of their body was gone. Couldn't be used. So just remember, they'll always test you on this. If you only give beta blockers, you're going to have this unrelenting alpha cascade, and that'll cause its own problems. This is where they have here, well, consider a mixed one. Consider labetalol. Yeah, okay. Nicotine. One of the reasons pro models used to and still smoke a lot is because it gets rid of your appetite. You stay thin. When you come off, you have a gain in appetite, gain in weight. LSD. Whenever someone's seeing funky things and they include flashbacks in the stem, it's always LSD. Marijuana, dry mouth, they always talk about red eyes. Always, always, always. Paranoid delusions, they usually put that in there too. But you'll always have conjunctival injection and dry mouth. Okay. Mdma, disinhibition, hyperactivity. They do talk about bruxism, which is just when you kind of take your teeth and brush them together and push them together. But the big thing is just hyperactivity, euphoria. And let's go through the difference between someone on ecstasy and someone on cocaine. Well, just from the name, ecstasy, ecstatic, feeling great. Someone on cocaine is in a, hey, let's do everything right now sort of mood. Similarly, or interestingly similar to someone who might be on a manic episode. Oh, we gotta do this, we gotta do this, we gotta do this, we gotta do this. The difference, though, is someone on cocaine is much more aggressive. I mean, there's a lot more differences, but, if you were just trying to see a quick little thing, it'd be that. PCP. PCP is the only one here where in the stem, if they give you violence, immediately think PCP. If someone has nystagmus, immediately think PCP. Okay. And here, alcohol use disorders. Wernicke-Korsakoff syndrome. Results from vitamin B1 deficiency. So what does that have to do with an alcohol use disorder? Well, alcohol is going to impair small intestine thymine absorption. Thymine is, of course, B1. Alcoholics, as a general rule, don't have a good diet. They're either only drinking alcohol or they're just eating a bunch of nonsense, and because of the alcohol, it's making it harder to absorb good nutrients. Remember, you need to take in vitamin B1. You don't just make it. Thymine, necessary for pyruvate dehydrogenase in your citric acid cycle. Let's look at, here we go, alpha-ketoglutarate dehydrogenase. Need it for this, need it for this. You're going to be in a heap of hurt if you can't access your citric acid cycle. So, what ends up happening? Well, can't feed your brain, can't feed other organs. Things are going to get a bit rough. So, what's a mistake that they always test you on? It's we're just going to give him dextrose before vitamin B1. Well, if you do that, if you give someone a bunch of sugar before you give them the B1, well, it doesn't really matter. They can't go into the pyruvate dehydrogenase complex. You're just giving them a bunch of stuff that can't turn into what needs to be, like what you need. Maybe you end up shunting something from pyruvate to a lactic acid. You know, gotta think about that. They do like testing acamprosate and disulfiram. Disulfiram, of course, will make it so that way if you ever have alcohol, it'll just give you the alcohol dehydrogenase to aldehyde dehydrogenase kind of blockade, and you'll be stuck with the poisonous form, and you won't be able to get rid of it. Yeah. Yep, yep, yep. It's always the big thing here: PCP, violence, nystagmus, cocaine. Why don't you use pure beta blockers? Look for perforated nasal septum. For weed, dry mouth, conjunctival injection, wernicke-korsakoff syndrome, mammillary bodies, always with B1 deficiency. Alcohol is going to impair this. Disulfiram will always make you throw up when you drink alcohol.